right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and today we're going to just do a straightforward deep dive on lip lifts. The reason is lip lifts are super popular. They're all over social media. You may or may not know they're all over social media. You may or may not know anything about them, but they are a double-edged sword, and it's really important you understand what they really are and what they can do and how they can go sideways. So I'm going to give you everything you need to know about lip lifts in the next 20 minutes or so. So number one, what is a lip lift? And it is what it says it is. It's lifting the lip. Which lip? The upper lip. So essentially, it's a facelift of the upper lip. So why would you ever do that? So as we age, usually, it's age related, but sometimes just by your anatomy, the upper lip length, the length of the upper lip from under the nose to the Cupid's bow on your lip starts to get longer. If you look at pictures of, let's say, a 16 or 17-year-old, that distance is very short. The lip swoops outward, it's everted, and it's got a nice curve to it. If you look at a 75 or 80-year-old woman or male, that lip length is long. It's convex, meaning it sort of scoops inwards. The upper lip sort of disappears into the mouth. So obviously, having fuller or more attractive shaped lips is very desirable. So when we do a lip lift, what we're essentially doing is taking a wedge out from under the nose and removing the redundancy or the excess of the upper eyelid, hence shortening the distance and bringing more of the pink part of the lip up and exposed. So a lip lift has two purposes. One, to shorten the distance, which in and of itself is attractive. In other words, we think about like big eyes are attractive, a cute nose is attractive. Well, a short distance is attractive. You just don't know that because you never really pay attention to the upper lip length distance. But there is every single gorgeous person, and predominantly this is a female related thing, has a shorter distance. The second thing it's designed to do is create more visible pink lip. That is, make your lip seem larger and more visible. Now, we have obviously people who are doing filler, and with the advent of filler, it has sort of, it's done different things. When you add filler, you're not shortening the distance, right? Because you're only adding volume to the lip itself. And in many instances, you're making the lip really big and puffy, and you're making it three-dimensional. In other words, what's happening is when very commonly people are like, I hate lip filler. Why? Because it makes you look like a duck. And what they mean is when you turn to your side, the lip looks like it's jutting forward. Because when you add volume and you're adding to the lip, it puffs up the lip, but it does so three-dimensionally. So yes, in the front view, you have more pink visible, may be desirable as that's what you're trying to do. But from the side view, it's also moving forward and sort of looks odd. It's particularly odd in more mature women. So as far as candidacy is concerned, a lip lift is designed for someone that's a bit more mature because of several factors. Number one, inherently their upper lip length is increasing. Two, their upper lip is slowly disappearing and getting smaller. And three, they're not going to look so good with filler because it's going to look a little odd in a mature woman when you have filler in. Yes, you can do filler incredibly subtly, and yes, it can look natural, but still, you're not going to ever look as good as when those two other factors are corrected. So that's where sort of the ideal patient or the ideal candidate is someone who has aged a bit and that length is a little bit longer. If you have fillers in already, which often is the case because you start out with fillers and then you're like, God, I don't like the filler, or maybe I don't want to keep doing the filler. If you're going to go towards doing a lip lift, you absolutely want to have that dissolved because it's going to alter the ultimate outcome or the end point of how much skin you need to remove. Remember, this is permanent. This is a surgery. There's no going back. There's no reversing it. So it's very, very important that we be accurate. And hence, you want to make sure that you reverse any filler that's in there. As far as scars are concerned, where are the scars? So this is really, really important. You want to make sure that the scars are concealed. Like if we do an upper eyelid surgery, you're not going to ever know where that is when it's done correctly. When we do a facelift surgery, it's incredibly concealed. So lip lifts are sort of concealed. What do I mean by that? They're supposed to be placed, the pattern is called a bullhorn. It looks like the horn of a bull. And it's placed in the right underneath the nose, into the sill of the nose, underneath the columella, and back around the side. So it's right in the crease of your nose. Now, some people have a naturally sort of invaginated crease. In other words, it goes inwards, which is perfect because it hides the scar well. Other people that area is very outwards or it's exposed, and so the scar will be more visible. And so the way the scar is placed, the way the scar is closed, and the way the scar heals is very, very important. I have seen hundreds of visible scars on patients who come to me for, I don't know, nose job or eyelid or lip filler or what have you. And frankly, I personally think that if you do it and you have a really visible scar, I don't think it's a good trade-off. So it should be done so well that the scar heals beautifully and isn't visible. Now, it's a surgery. Can I do it in the office? Yeah, I can do it in the office. I can do it under local, but it's still a surgery. And by that, I mean that it's permanent and there's no reversing it. Like filler, you can reverse. I hate it, it goes away. This is a surgery and therefore you need to treat it as such. So it's probably a 30-minute to an hour-long procedure. It can be done under local or in the operating room in conjunction with other things. The recovery is about a week of the sutures or the stitches that I use have to be removed around 5 days. And you're kind of look pretty normal around 4 to 6 weeks. Remember, you're a little tight and that area relaxes. And so for a little while, it's a little tighter. And when you smile, it's not as natural looking. Now, the main thing, the reason why I'm having this conversation is because I think the lip lift is being way overused. Way overused. The reason being is if you go on Instagram or social media, often you'll see a ton of these so-called models, self-touted models. And when you look at their photos, you're going to notice that their lips look super everted and the distance between their nose and their lip is really, really short. Now, you can make the argument that in photographs, they kind of look attractive. It's a very specific look. But unfortunately, in person, I think they look really weird. And the problem we're having now is, unlike the candidate I spoke about, which is an older woman, I don't know, 40s, 50s, 60s, 20-year-olds are going to get lip lifts. And they're doing it because A, they don't want to keep doing filler. Well, crap, I'm going to just go get a facelift even though I don't need it because I don't want to do X, Y, and Z. That doesn't make any sense. So they're doing it A, because they don't want to do filler. 2, they're doing it because they like that sort of Cupid's Bowie look, sort of appearance on their photos. So they're going to make themselves look odd in person in exchange for so-called better photos. And it is irreversible. And in my opinion, doctors should be ashamed of themselves. Because if I had a young girl come into my office who is, let's say, 23, beautiful girl, very normal anatomy, meaning the distance from her nose to her lip was very appropriate, and she wanted a lip lift, there'd be no way on earth that I'd do it. Because I know that she's going to look a little, in my opinion, silly or weird, animated or odd. And even if she's like, oh, I don't care, I like that look, it doesn't mean that I can help her with self-suicide. So I think that they're just way being overdone. It became popular. It's a trending thing. Doctors are really pushing it because it can be done under local. And frankly, I think the scar is something that you have to trade off, right? You have to be willing to, oh, wow, your lip looks so much better. Oh, that little scar, I don't care. But like if your lip doesn't look better, it's a big trade-off. And 2, I think that it's a very powerful procedure that can really make you look different, if you understand. In addition, and what's an adjunct is, if you understand what I was describing, we're lifting the middle of your lip based on the width of your nose. So in individuals who have the ratio of the width of their nose to their lip is relatively, I don't want to say similar, but not that far off, a lip lift can be done in isolation. Because when you lift the middle of that area, the majority of the lip will become exposed. In individuals who have narrow noses and really wide mouths, you have to do additional procedures along with the lip lift in order for the whole lip to open up. Otherwise, what you're going to do is you're just going to pull the middle of the lip up, and that looks absolutely bizarre. So imagine I just pull the middle of my lip up, but the corners of my mouth stay where they are. Well, then it's going to look kind of like rabbit-like. When you have that anatomy, then you need corner lip lifts, that is the lip lift plus removal of skin on the corners, so that in totality, the entire lip everts and you see more of the pink of the lip universally across, rather than most of it in the middle and not so much in the corners. So adjuncts to it are going to be central lip lift in addition to plus or minus corner lip lifts. And that's very important for you and your surgeon to discuss. So do I like lip lifts? Yes, but in the right patient. I think in the right patient, super powerful. And it's very commonly added during a facelift or other facial rejuvenation, because generally if you're getting a facelift, right, you're usually in your 50s, right, late 40s, early 50s and 60s. And yes, at that point, in addition to the sagging brows and the eyelid skin and the this and that, the other, your lip has extended. But I think you need to be incredibly cautious if you're a young girl and you're thinking of a lip lift as an alternative to lip filler, because it's like highlighting your hair versus shaving your head. They have nothing to do with each other as far as I'm concerned. So that's essentially the skinny on lip lifts. So I hope that's helpful. And yeah, we'll see you next week on Plastic Surgery Uncensored. As always, two things before I end this. One is go write us a positive review. We love it. Everybody gets so excited when somebody writes something nice. And the other is share this episode and all our episodes to people you love, because the last thing you want to do is come home one day and see a good friend of yours with some bizarre lip, find out they had a lip lift, and say, God damn it, I should have sent you that episode. They're not going to tell you before it happens. So send all our episodes out, and we'll see you next week on Plastic Surgery Uncensored.